If you think bladder infections are a female problem, well, you better listen up because when a woman has a bladder infection, she is probably not going to be in the mood for anything else. So, men and women, if you get bladder infections, you probably want to listen to what Dr. Dana Rice has to say. She is a urologist practicing in Washington, D.C., and she is very passionate, so passionate about urinary tract infections that she actually created an app about urinary tract infections. So today we are going to talk about urinary tract infections or bladder infections. Hello, Dr. Rice. Thank you for doing this.
Hello, thank you for having me. It's been a passion of mine for a little while to help people with urinary tract infections. And the more I can get the information out there, the happier I will be.
Yeah, so I do see some UTIs as well, or bladder infections. Tell me your experience. What led you to become the advocate for UTIs and
Well,
treatment?
really what brought me to it is I'm a female, obviously, and I'm in a major metropolitan area. And besides all my friends having UTIs in college, I had UTIs as a child. And then when I went into private practice, I was seeing, 14, 15 patients a day who had urinary tract infections.
Wow.
Yeah. And I was thinking to myself, what is going on? How are these people getting to a urologist who is a surgeon for what sometimes are simple UTIs? And then sometimes people actually need a urologist. So there was such a high need that I thought, in this day and age, we need an easier way to figure this out.
So let's break it down. What do you typically see when you see a patient coming into your clinic, the 14, 15 patients? How do they typically present to you?
Right. So it sort of depends on the patient themselves. So usually my college girls, it's something like, Doc, I started having sex not too long ago. It burns after sex. I have this I gotta go feeling. I've seen every urgent care, minute clinic, primary care doc I have ever known. I still have this problem. And then the other demographic that was really huge and surprising to me actually when I went into private practice was I'm perimenopausal slash menopausal and I'm getting urinary tract infections all over again. And I don't want to go through this. So please help me. So burning, stinging, pain with urination, all the kind of things that every woman in America hates to have.
Yeah, and sometimes suprapubic pain, blood in the urine, sometimes back pain, sometimes fever and stuff like that. So those are fairly typical.
You got it. The common UTI type stuff is what I was aiming at. And what I realized is that there's so many things that people, don't know about, right? Like blood in your urine doesn't have to be a UTI. It can be a lot of other things. And if you go on Dr. Google, then all of a sudden you're panicked because I have cancer immediately, right?
Yes.
So I needed to find a way to sort of put all the information into one easy to identify, not drinking baking soda out of a backroom concoction identified by some person blogging who had no medical experience. So I wanted to kind of put it all in one place.
What about this apple cider vinegar panacea for stones and infections and cancer and everything else? What a bunch of hogwash.
Yeah, you got it. I mean, there's some stuff that you can read that's great, but the problem is in this day and age, you don't know where your resources are coming from because there's so much information. I literally had someone in my office drink pure baking soda and have salt problems and have to get hospitalized because they blew out their electrolytes. And I was just like, these women are so desperate for help, and men too, but mostly my women, that they would try anything they read. And I just thought, gotta fix this.
So when the patient actually presents to you in the office and they come in with these symptoms, how do you work them up, and later on, how do you treat them and counsel them?
Right. So it sort of depends on what's going on, right? So you have to sort of first triage patients into people who have medical problems. So if you have immunocompromised, diabetes, HIV, things that are more complicated, that's a whole different ballgame. And then I sometimes need imaging and I need more of an extensive workup. But when I have sort of run of the mill, healthy young women, a lot of times I have to start with history and gathering information and then going back through and figuring out, hey, did you really have bacterial infections? Or are you just having pain after sex with an irritated urethra? And those are very different patients. And then when you throw in menopause in there, then you start talking about lack of hormones and estrogen and irritation after sex. And so the workup can really range from simple, hey, this is what you need to know during sex. Like I did a podcast with Ashley Iaconetti actually for sex type stuff because a lot of people in their 20s don't necessarily practice what I consider safe sex. In other words, they're switching holes without washing in between. That's a problem. I don't know why some of the younger people don't know this, but this is something I have a conversation about. And then when you get into the older populations and you're thinking about, hey, menopause really takes a toll in a lot of different ways, people look at me and say, why has no one ever told me this? Well, because the generation ahead of the baby boomers didn't talk about menopause. So lots of different ways.
It surprised me when I saw an older lady who didn't know the location of her urethra, her urinary opening.
Yep. You would be amazed what people don't know because they don't talk about it. And one thing that drives me crazy is, more than 60% of women in their lifetime will have a urinary tract infection. And that number is still around 15% for men, right? So that's a whole lot of people in the world who get urinary tract infections. And if you don't know your anatomy and know potentially why you could be having these on top of non-anatomical reasons why, you can get yourself into a world of trouble. I don't understand why we don't talk about it more openly.
Well, I don't think we talk enough about urinary tract infections or sex for women, especially orgasm and sexual function and dysfunction, and what is normal.
Absolutely. Right. Absolutely. I mean, hopefully things are changing, especially now that in urology, we're starting to see more women. You're starting to see a lot more men who are helping with women's issues. You're starting to see sex medicine emerge. You're starting to see a lot of different things come into play. But no, years ago, that was a woman problem. Put it away.
What do you see as the number one associated activity or condition associated with the recurrent urinary tract infections?
I think number one for me is probably sex. So postcoital infections is the number one thing that I see.
Yeah, likewise here in Gilbert, Arizona as well. And then other things that can complicate bladder infections include, urinary tract infections. We're talking about women now. Urinary tract kidney stones. Obstruction or not emptying your bladder, or cystoceles. Anatomical abnormalities causing them to retain urine. Sometimes bladder stones and tumors, or past surgical history with a piece of suture that is traversing through the bladder, which I've seen before.
Yeah, exactly. So a lot of people, foreign bodies, just like you said, any kind of suture, if you've had hysterectomies or any kind of GYN surgery, you can have a foreign body on there and not even know because you didn't know you had a bladder problem. And then, like you said, people who have children or prolapse or things like that can have anatomical problems. So you see it a lot more than I expected to see it.
So this patient comes in complaining of symptoms typical of UTIs. You do the history, you do the examination, you check the urine, and looks like a UTI nitrite positive with white cells and microhematuria, blood in the urine. How do you start the treatment process, and then later on we'll talk about how do you counsel them to prevent infections?
Sure, no problem. So when I think it's a true bacterial infection, like you just said, nitrites, which is the byproduct of bacteria, blood in the urine, white count, things like that, there are pretty good guidelines that suggest what makes a true bacterial infection versus a non-bacterial infection. The problem for me is that treating a bacterial infection is actually fairly easy. I always get a urine culture. I always start antibiotics. And then if it comes back as a positive urine culture, I continue the course. If it's negative, I tell them to stop. The problem is that a lot of people will come to me not knowing if they have true bacterial infections because they've been started on self-start regimens, or they just called the on-call doctor and they got antibiotics. And then that's where the education really comes in, because for me, 90% of the battle is helping the patients that feel like they have a UTI, the burning, the misery, the frequency, the leakage, the horrible feeling, that don't actually have bacterial infections. And that's why I sort of do what I do, because putting together those pieces of a puzzle and being able to show that to a patient and say, hey, you have all these feelings, but no bacteria. Now let's get to the root of the problem. And that's really where the history and past history and going forward, looking at their urine cultures and convincing patients that this is not a bacterial problem really comes into play and is challenging.
Say that it is a bacterial infection. You treat it with antibiotics, and then you want to counsel them on prevention. What do you typically tell that index patient?
Right. So for my younger patients, a lot of it is sex education. Okay. How to all those wife's tale things that you've read about a million times. You don't wear a wet bathing suit. You don't do this. A lot of that's not proven, right? Basic hygiene is fairly standard. Yes, if you wear the same underwear 6 days in a row, you're probably going to have a problem. Most people don't do that. So most people just need to hear that they're not doing something wrong. What they need to hear is, are you drinking enough fluid? Are you a camel? Are you one of those people that pees every 6 or 8 hours?
Yes.
That's not good. You should be peeing more than that, right? So I counsel on sort of what I consider my dysfunction. Sit to pee, don't squat to pee. Make sure you drink enough fluids. And then I'm a big fan of natural therapies depending on what bacteria you have. So in my practice, D-mannose is something that you can get readily available on Amazon or Whole Foods. And if you have recurrent E. coli infections, it's fantastic. If you have infections, for instance, a bacteria called Proteus, then in the back of my head, I think to myself, do you have a kidney stone sitting around? And then I would do more of a workup. So for my index patients, I spend a lot of time in what are your triggers? Is it related to your menstrual cycle? Is it related to sex? Is it related to bowels? Let me figure out how and why you have these triggers, and then we'll put our finger on how to fix this.
And there's also been mention of sometimes the use of thong underwear. The constipation is also a possible known risk factor for
Yep.
ladies who are still having menstrual cycles. The use of tampons sometimes is associated with infection, so it could be a lot of different things. But when in the old days, we thought about bubble baths or baths as possible causes of recurrent urinary tract infections. The data is kind of not really that strong out there regarding those.
Yep. You got it. I think the very first thing that I do for my patients is really put them at ease and say, this is not something you did. Average everyday behavior is not your fault. A UTI is not your fault. This is something that is going to happen just based on female anatomy, short urethras, vaginas, things go in there, right? And the more they hear fables about, you can't take a bubble bath or you can't wear thongs or you can't do this, the more nervous they get. And then the more nervous you get, the tighter your pelvic floor muscles, the more apt you are to be a dysfunctional voider or not empty your bladder quickly. And guess what? There come UTI and UTI-like symptoms. So a lot of it really is just behavioral modification and teaching. Education.
Do you see certain types of or women in certain types of occupations as being higher risk for recurrent bladder infections?
Yeah, I usually tell my patients, anyone who has a job where you're a camel. So a lot of times that's my teachers. They can't pee a lot. My librarians, my nurses, my doctors, right? My surgeons. People who don't empty their bladder have a lot of UTI-like symptoms. And then the other thing is really a lot of A-type personalities, because just like you can grind your teeth when you're nervous, some people hold pressure in their pelvis, and pelvic dysfunction, pelvic floor dysfunction can mimic UTI-like symptoms, frequency, discomfort. And people don't realize that.
Sometimes I see that among men and women with more type A personalities, and they really tighten their pelvic floor muscles from stress or just the way their body's built, the way they respond to their environment, and that sometimes can mimic UTI symptoms.
Yeah, exactly. And that's why I think that tracking UTI symptoms is so important, and why I'm trying to make it easier for patients, because it's really hard to have someone sit in front of you and say, everything you've been told for the last 6 years that was a urinary tract infection is not a bacterial infection, that it's something else going on. And it's not until you can kind of lay out the pattern that patients are more willing to listen to. Oh, yeah, every time I have a huge trial, if you're a defense lawyer, or every time I have an 8-hour surgery because you're a vascular surgeon and you're so tense for 8 hours and not peeing, right? Once you sort of see your triggers and can put it together, then you're a lot more apt to hear what I'm saying about UTI prevention or pain like UTIs, because it's not always a true infection.
One more category of women who are at risk for recurrent infections and acting as camels are my women who work in call centers. I don't know if you ever encounter any of these ladies. I mean, these ladies, men and women, are tracked almost to the second about their productivity at call centers. So locally here, we have quite a few call centers, and they are just in cubicles, and they are tracked every time they leave to void. That time is taken away from their productivity.
Oh.
So yeah, they are really tracked carefully. So those, and also I have locally here Intel, which is a fabrication, does chip fabrication, and for guys and gals in clean rooms. So they have the gown up, put in bunny suits, and go into the isolation chambers and stuff like that. Those guys and gals may be at more risk because they behave as camels as well.
Yeah, I mean, that makes sense to me. I don't have that around Northern Virginia, DC area all that much, but you're exactly right. Anyone who has to hold their bladder, long-term truck drivers is a lot of men that I see because they're, holding their bladders for a long time. There are lots of people that have similar issues in all demographics, and it applies. I mean, bladders are dumb organs. They fill and they empty, and we have to figure out how to do it correctly.
So I'm going to now talk about your app, which is called UTI Tracker. And I'm showing on the screen a shot of your website called utitracker.com, right?
Yep, you got it.
And it's available for download in the App Store and Google Play Store. It's basically a digital tracker to track and educate people with recurrent urinary tract infections.
Yep, you got it. So I put together an app that allows people to figure out what their triggers are. And then I tried to build in sort of information and education and warnings and things that you need to talk to your doctor about and pay attention to. Because what I found is a lot of people would come to me with either piles of information that was very hard to sort of decipher through and took a lot of time, or people would show up at my doorstep with, I've had 9 infections and not one bit of information. And then I had to start from scratch. So in this day and age of period tracking and apps, and everybody has their phone with them in the bathroom, for better or for worse.
Yes, yes.
Right? This is at your fingertip way of tracking everything from when it burns, when it stings, when there's blood, if you're constipated, when you had sex. It's got a little bit of everything in there. And then it's got deeper level function too. Did you go to urgent care? Did you have a culture? What were the results? So what can happen is, for me, if I have kids in college who have been treated at 6-minute clinics across their college for the last 9 months, and they come and see me in the summer, they can just open their app or print it out and say, here, doc, this is what I had and this is how I was treated. And then I've got a whole lot more information that's medically accurate and easier for me to follow.
So I'm showing the audience a couple of screenshots. One is a calendar, and it looks like there are simple things that you can tap on top, whether you had sex, or whether you're having a period, whether you're having an infection, if you have diarrhea, constipation, or you had normal bowel movements. You can just click on a calendar and then click on the condition above, and it'll automatically track for you. And on the right-hand side of the screen, it's tracking symptoms. If someone has a urinary tract infection, burning, blood, fever, back pain, frequency, urgency, or none of the above. So that's just a couple of screenshots on the UTI Tracker app. And it sounds like it summarizes all the symptoms from a patient. Hang on a second. We seem to have lost our Zoom. Stand by. Technical difficulties. Somehow Zoom kicked us out, so I'm going to try to get back in there and see if I can get Dr. Rice back on. So we've been talking about bladder infections and an app called UTI Tracker that was created by Dr. Dana Rice from Washington, D.C. She's in private practice in an employed position as a urologist who sees a lot of bladder infections. Let's see if I can get her to come back on. Lovely technology. Sometimes you can make it work. Sometimes it just doesn't want to cooperate. Well, unfortunately, I'm not able to get Dr. Rice back on. So what I'm going to do is try to end this Zoom meeting. And I will put Dr. Rice's app and her contact information in the video description below. And see if you are interested on the UTI Tracker. Feel free to click on the link and check it out. So I hope this has been helpful, and have a good night.